Okay, so we're going to be going over how to apply a condom catheter to our male patient. Condom catheters are helpful in someone who's incontinent and maybe not able to get to a urinal in time, but that we may not want to proceed yet to an indwelling catheter, and perhaps we're wanting to they'll control that incontinence for skin integrity, comfort, etc. Unfortunately, there are only male condom catheters. There isn't a female version at this time, but we'll go over that, what you're going to be doing to apply it. So most facilities at this time have this style of condom catheter. It comes in a bag. There's different sizes. This is a medium size. Some wards only stock one size, one or two sizes, so just have a look at that. There are some other types and brands, and we'll have these out in the lab for you to see. They're essentially the same thing, they're just slightly different brand and sort of system. So there's a couple different types that you may see out there, but currently this is sort of the most common one. The other thing you're going to want is your drainage bag or potentially a leg bag, depending on the situation, to attach to. So want to make sure you have a new drainage bag. We're going to make sure that we've performed pericare before applying the condom catheter. Generally, they don't actually stay on for that long, but you'd want to make sure that you're, regardless of having one or not, that it's being removed at least daily or twice daily so that your patient can have good pericare done. We're going to need clean gloves. And depending on the patient, we're going to maybe clip hair around the area so that you'll see with the catheter it's kind of got an adhesive on the inside. You don't want it to stick to any hair and be pulling. That would be quite uncomfortable. So you can just clip with scissors carefully any hair that's around the base of the penis. So Jake, we're just going to expose you here briefly to apply a condom catheter, and you'd want to definitely explain it to your patient as well. Okay, so on Jake, we can remove the genitalia just to get a better view of what we'll actually be doing to apply it, but generally you'd be working obviously between the patient's legs. So again, we've done pericare before starting. We've cleaned our hands. We have our supplies ready. We're going to apply our clean gloves here. And again, this is a clean procedure, not a sterile procedure. Generally, these have a perforated edge. You just kind of have to find it to open the package here. Something else you can do is apply a skin barrier protectant before and then let it dry. It just kind of helps the adhesive that's in the catheter not hurt the skin over time. This patient is circumcised, so we're not going to do anything with the foreskin because it's not there. If your patient is not circumcised and has foreskin there, you're not going to retract it in this instance because then it will stay retracted and potentially give the patient a phimosis. So we're going to leave it as such, and you're going to want to stabilize the shaft. You see that the condom catheter has sort of like a plastic guide on it, which is helpful for moving it down, but you generally want to kind of stabilize the shaft, and you're just going to put the top through, and you're just going to roll it down like so. And again, it's not always a perfect fit or size, but this is pretty close. And you do sometimes get that little bit of rollback here. So that's where it is helpful, again, if you trim any sort of pubic hair that's in the area so it doesn't pinch or pull for your patient. And we're going to remove this. This can just be thrown out. And now we're sort of ready to go. We have our new drainage bag here, and we're just going to attach it there where we are wanting the urine to come out and collect in the drainage bag. So you're going to want to monitor the patient, their ins and outs, their comfort level, with it, and do some teaching about it, what it's for, why you've applied it, etc. So making sure that's good and secure. And then this is just going to hang lower than the patient on a non-movable part of the bed. You don't want to attach it to a side rail, etc., because it will inadvertently tug if it's released. Make sure, despite having a condom catheter applied now for this patient, we're still going to be checking their brief quite often or at regular intervals, because sometimes they do come off or they unfold. That's often the case that before even the end of your shift, it may have just fallen off from sweat or movement, etc. But it might have helped to keep the patient dry for at least a few hours. So you do want to just keep checking, though, to make sure that we're not thinking, well, he has a condom catheter, so we don't have to worry. We'll still be monitoring. And of course, again, you want to monitor the skin condition and the patient's comfort level if it stays on for a little bit longer. All right, and that's it.